hearing, what we're seeing at Apex is that our employers' pharmaceutical claims are accounting for 15 to 25% of their total spend, but sometimes as high as 40 to 45% of their total healthcare spend. So what we heard today is transparency and how to make a dent about that. If the goal was for PBMs to bring down pharmaceutical costs, Chairman, and I think we all believe that was the goal, it has evolved into something much more opaque. But transparency means a word that, as the last presenter indicated, means something different to different people. Primarily one is this: the ability to audit, the ability to not only see the contract, not only be able to negotiate the contract, but be able to audit the results of that agreement. Just because a PBM says they're rebating so much under the contract language, how do we really know, for example, what that's happening? So without licensure, without a huge government bureaucracy to try to manage this, if you would just do some things like that, so that we can see claims data in real time from the carrier, from the PBM, not just about pharmaceuticals, but about all healthcare claims. We live in an age now where we have the technology that you can give data like this. And who owns that data? The employer, about their employees, the employees themselves, or is it just the insurance companies? It's shining that light into the dark recesses of the insurance world and the PBM where we can really start to make some savings and make a difference in the lives of people.